Welcome to Clinical Conversations. I'm Joe Elia. Our inquiry into the medical aftermath of the Boston Marathon bombings continues with Dr. Brien Barnewolt. He's the emergency physician-in-chief at Tufts Medical Center, where he's chairman and chief of the Department of Emergency Medicine and an assistant professor at Tufts Medical School. Welcome, Dr. Barnewolt.
Thanks.
Tufts and Boston Medical Center are about equidistant from the bombing site, and things must have started to get very busy for you very fast.
We typically are very busy during Marathon Monday. We are the closest hospital to the finish line, about a mile away, so closer than any other medical center. And typically we receive pretty much the sickest patients from the marathon. Pretty used to doing that and have done that over the years. In fact, we had just met with BAA representatives in Boston EMS just the week before in our traditional planning meeting, and we were reminiscing over the previous years and how smoothly things had gone, and talked about really writing up our experiences and taking this on the road
Really?
to other marathon venues around the world. So.
Well, things changed rapidly within that week. Now it's going on about 2 months since the bombings. Have you noticed any differences in how your team works together, or have you come up with new ways of doing things as a result?
I think there's been a rededication to some of the training and planning that occurs around mass casualty events. It was kind of after the 9/11 bombings that hospitals really looked internally and developed procedures and plans, and we did as well.
Yeah.
And a lot had been done during that time, and the plans did work, but there's been turnover over the years, and plans have kind of sat on shelves for a time being, and we really had to dust them off and look at them. We had a good result on that day, but at the end we decided that we really needed to go back and rehash some of those plans and decide how we would do things a little bit better next time around, if there's a next time around.
Yeah. Well, it was fortuitous that the bombings occurred at the shift change in those hospitals, and so you were, in effect, double-staffed.
That's right.
And I keep hearing from, when I talk to the other emergency department heads in town, I keep hearing about all the drills that they have been through leading up to the marathon. Just since 9/11, I guess it's been something that emergency departments do. Let me ask, have you had a drill since the marathon bombing, and do you think the staff now finds it easier to take those drills more seriously than they may have otherwise done?
We've not had a drill since the marathon bombings. Right now we're getting ready for the July 4th Esplanade celebration, which itself brings 250,000 people into the city. So there's certainly planning for that. Every time there's a major event like that, whether it's the marathon or January 1st or July 4th, we put in place our disaster plan, and we activate it, and we treat it as a real exercise. So we haven't drilled in that sense, but July 4th is right around the corner.
Yeah, I'm just kind of probing around the periphery here. That bombing event was such a big thing in the consciousness of the community, and maybe sometimes big events don't carry big lessons. But I'm wondering, do you think there was a big lesson from it?
Well, certainly all the planning and preparation paid off. Everybody was exceedingly lucky that day. Things could have been much, much different than they were. But the planning and preparation did pay off. And I think that's a huge lesson. When you keep doing these things over and over again, the drills, you wonder if there's ever going to be a time where you really put things in play. Nobody expected that kind of event on that particular day. So I think that's one big lesson. And then every emergency department has their own kind of individual lessons, I think, that they learn. One of ours was our nurse manager had the presence of mind to round up our staff very early on, literally seconds after the bombing, and told everybody to call their loved ones right now. Get it out of the way. Let everybody know where you are, that you're safe, so you can put your mind at ease and do your job.
Wow.
And in our after action, that was a key thing for people. Everybody really appreciated that, and it did allow them to pay very focused attention to what they were doing, not worrying about their family, wondering about how they might have fared through all of this.
I keep asking a question of your colleagues across the city. How would you want people to act differently, say, with a forthcoming 4th of July events, or, in places where they have things like First Night, as we do in Boston on New Year's Eve? How would you want them to act differently as clinicians than they may have acted before this event?
I think the clinicians all did a wonderful job. Many places, including us, had an excess of capacity. We had a lot of physicians, so much so that we actually had to kick people out of the emergency department into staging areas so that we could draw on people as we needed them. But everybody was exceedingly patient. I think, simple things, wearing your identification badge, super important in a time when you have potential explosives. Immediately after that event, a lot of people were listening to rumors, well, there's another suspicious package there or here. And so knowing who is who and that they truly belong in a particular setting is super important. Some reluctance for some people to wear their identification badges, or insisting that they are who they are and they belong there. But in that kind of environment, it's identification is exceedingly important.
Yeah, it's a very simple thing, but as you've observed it, it certainly helps. Have the various medical centers in the city now started trading experiences around those bombings?
We've been doing that. We just met a group of us 2 days ago to do a kind of a structured debrief and learn lessons. And for all the emergency departments, a lot of the events were very, very similar. So in that sense, it was good to hear some of our problems were the same problems, the influx of people, but also the desire for people to want to help. Whatever we needed to do, whatever they needed to do, people were very responsive for that. We kind of had a unique situation ourselves in that in the event, we ended up having to evacuate our own emergency department.
Now
having to pick up your patients and move them out of the ED.
And you did that because of there was a suspicion that there was a package there?
Yes, there was a patient who had come in that was completely unrelated to the marathon and wasn't herself able to communicate real well. And at some point, her belongings were delivered into the room, and that's exactly what they were, was her own patient belongings.
Yeah.
But at that time, not everybody could identify clearly where those belongings had come from, had they been searched, and there was an enormous presence of law enforcement in our department as in others, and caution really took precedence there. And so in a period of 5 minutes, we had completely and totally evacuated our emergency department.
Wow. Well, Dr. Barnewolt, I want to thank you so much for spending time with us today.
It's been my pleasure.
That was our 163rd edition. All earlier conversations may be found at podcasts.jwatch.org. We come to you from Journal Watch. I'm Joe Elia. Thank you for listening.